Thank you, Governor Ricketts. Good morning. Again, my name is Becky Wiesel, and I'm currently serving as the interim deputy director for health licensure and environmental health with the Division of Public Health. And I appreciate the opportunity today to share information with you about this new essential caregiver guidance for long-term care facilities. And the Essential Caregiver Guidance document is intended for nursing homes and assisted living facilities that choose to designate essential caregivers within their facilities. And again, I emphasize choose, because this is not a requirement. This is something that a facility may use if it works in their facility. And as Governor Ricketts mentioned, an essential caregiver is a person who was previously engaged with that resident prior to the pandemic. So it could be a family member. It could be a caregiver who had worked with them prior to the pandemic. But that relationship is very important. And the guidance is important because it does provide family members and these other caregivers who've worked with residents the opportunity to spend more time with that individual. And it provides long-term care facilities an opportunity to supplement the limited staffing that they currently have by using these valuable volunteers. Now, essential caregivers have an important role in providing care for these residents in our long-term care facilities. And it's because of those existing relationships with the residents that essential caregivers are able to observe and communicate important details with the facility staff about a resident's change in condition or behaviors that might not be what they consider normal for that resident. Essential caregivers also provide emotional support to residents, and they honor the personal values and preferences of care for those individuals. But most importantly, essential caregivers help promote the quality of life for residents, and that's what we're all trying to achieve in our facilities throughout the state. So in advance of this program, we want to thank all of the essential caregivers who participate in this program for the significant contribution they will make to the well-being of the residents in those facilities. Just a few examples of some of the guidance that's included in this document. First of all, facilities must establish policies and procedures for how they intend to designate and utilize essential caregivers in their facility. And as the governor mentioned, that will take time. So this isn't something that will happen next week. Another thing that they need to consult with the facilities administrator, perhaps the director of nursing or social services director, or other designated facility staff to help determine what individuals might meet the criteria for being an essential caregiver. And of course, the resident needs to be included in this decision, and they need to be consulted about their wishes for whom to designate as their essential caregiver. Now, the guidance also includes necessary precautions to prevent the spread of COVID, such as essential caregivers would be screened just as employees are screened prior to entering the facility. They would be required to wear appropriate PPE and use frequent hand hygiene, just as we all are doing. And the plan does limit the number, a facility should, in their policies and procedures, limit the number of essential caregivers who can be in a facility at one given time. Now, the essential caregiver guidance for long-term care facilities can be found on the DHHS website, and that is dhhs.ne.gov. And if you click on the link for Learn About COVID-19, the document will then be found under Guidance Documents, and it should be out there as of today. And I would like to thank Jennifer Acerno, who's going to be speaking here shortly. She is the president and CEO of Leading Age Nebraska, and she was instrumental in the development of this document, as well as Heath Bodie and Cindy Cadavy with the Nebraska Healthcare Association. Those two organizations have worked collaboratively with DHHS throughout the pandemic, and we meet regularly with facilities at least twice a week, and share guidance and information, and we do our best to answer questions. So I will turn it over to Jennifer. Thank you.
Thank you. As was mentioned, I'm Jennifer Esterno with Leading Age Nebraska. I'm happy to be here today. I want to thank this group for the opportunity to visit some more about this program that DHHS has worked to develop that is a tool in the toolkit that long-term care may utilize in helping to facilitate and mitigate the impacts of COVID-19 on our long-term care residents. We would like to thank, Leading Age Nebraska would like to thank DHHS for the continued collaboration and looking for innovative ways to try and address these issues. Both Leading Age Nebraska and Nebraska Healthcare Association have worked very closely with DHHS to help evaluate efforts and opportunities. The Essential Caregiver Program has been adopted in some other states, including Minnesota, Florida, Indiana, and South Dakota. The Nebraska program is modeled after the Minnesota program. There are some differences with the Nebraska program in that it does not require a facility to register to participate, and there is no set time frame to enter the program. One of the most unfortunate results of this pandemic has been the necessity of the state and federal guidelines that have been put in place to protect residents who are among the most vulnerable to COVID-19. Typically, we would say that we like to engage residents with social activity and we encourage that, but we recognize these times are not typical. Isolation has, however, taken a toll on long-term care residents, physically, mentally, and emotionally. And this program allows for an essential caregiver provider to help maintain resident health across that spectrum. Essential caregivers will help to reduce isolation for long-term care residents, while also, as Becky alluded to, assist those facility staff in doing some of those more routine tasks that those family members or essential caregivers may have already been engaged in doing prior to the pandemic. There is hope that that will free up some of the staff time for long-term care providers, as right now workforce shortages are significant in that area. We would like to express our appreciation that the program is a voluntary program, that it allows providers to assess their specific situation and ability to implement the program if they choose to do so. Providers are keenly aware of and very supportive of trying to do what they can to help residents feel some level of normalcy and engagement at this time, because it has been very difficult. Providers will need to consider things like community spread, access to PPE, staffing availability to help with screening, and a number of other things as they determine whether they will implement this program. Some may be able to implement in the next few weeks, and some may have to hold off. I think it really depends on each facility. So we recognize that providers will need to assess how this program fits within their ability to implement. And I would just like to also caution, as the governor said, that if facilities do decide to implement this program, which again is a great tool, that it will take time to put processes and other things to facilitate that in place. So really appreciate the work that's been done on this, and turning this back over to Governor Ricketts.
Great. Thank you very much, Becky and Jennifer, for working together to create this Essential Caregiver Program. Again, we want to caution that this will take time to roll out, that it'll be a choice for the facilities. I think you make a good point about they're going to have to take into consideration their ability to train the essential caregivers and community spread and all that, because we want to continue to protect those residents. But I appreciate the collaboration to be able to get this program up and running, because I think for the facilities that are able to take advantage of it, will be a help to the residents. So thank you very much. Appreciate it.